Dr. Amesh Adalja joins me now. He's an infectious disease expert and senior scholar at the Johns Hopkins Center for Health Security. Dr. Adalja, welcome. Great to have you with us. Now, we know that many hospitals are already past their capacity. There were nearly 84 as of Sunday. So what should we expect after Thanksgiving, as so many seem to be defying the CDC's recommendations to stay home for the holiday?
It's only going to get worse. We know that people are going to get together on Thanksgiving. We know we're going to see transmission events occur. The key thing is hopefully people, even when they gather, they're taking common sense precautions to try and reduce the harm that the virus is causing by decreasing the size, decreasing the number of households, trying to follow some of those common sense tips. But we know that it's not going to be ironclad, and this is going to put many hospitals back into crisis or into worse crisis than they already are.
So, Doctor, let's talk a little bit about the AstraZeneca vaccine. It's very exciting to have a third one on the horizon. The efficacy of this vaccine does change based on the dosage, however. Can you explain this to us, why that is and what it says about the vaccine?
Sure. So this is one of the puzzles about this vaccine. What they saw is people who got a half dose and then the full dose had a higher response, 90% or so, versus people who got the full dose both times. So we're trying to understand why that happened. It might be that the first dose kind of primes your immune system in a way that makes it more robust when it sees the virus the second time in the second dose of the vaccine. Again, this is something that's an active area of research. We don't quite know, but it likely probably will be that dose that they go for approval with.
So the AstraZeneca vaccine does not need to be stored in freezing temperatures, like those developed by Moderna and Pfizer, and it seems to be less expensive. Is that why? And what does all of this mean for the distribution of the vaccine?
Well, the AstraZeneca Oxford vaccine uses a different technology, something called, it uses another virus to deliver the protein from the coronavirus that generates immunity. So it's a whole different process. It doesn't need cold storage, and it is something that can be mass produced, I think, easier probably than the other two vaccines, at least from what we're hearing, and that's why the cost has gone down. So this may be an important vaccine, especially for the developing world, where we know it's going to be hard to distribute a vaccine that requires extreme cold, like the Pfizer vaccines. So I think it's really great that we have kind of this menu of choices, and this is part of the, I think, the value of a program like Operation Warp Speed, because they had so many different candidates kind of going through different stages of development, because we're going to need more than one type of vaccine for different parts of the world, because there are very huge logistical challenges to getting this vaccine into people's arms and turning it into a vaccination.
Right. And so now going from vaccines, I want to just talk about treatments, because the FDA has granted emergency use authorization for Regeneron's antibody treatment. That is one of the cocktails that was given to President Trump when he had the virus. It's aimed at helping people early on in their COVID-19 diagnosis. Can you tell us about some of the challenges doctors may face in actually getting this treatment to the people who need it most?
So the value of the Regeneron product, as well as the Eli Lilly product that received emergency use authorization a couple of weeks earlier, is that this is a way to prevent people from needing to be hospitalized. Early on in the illness, if we can keep people out of getting into the hospital, that really helps us in terms of the severe complications of hospitals, worrying about capacity. But the key thing is we have to identify these people early, and then we have to find a way to give them this, because it's not a pill they take or a shot they take. It's actually an infusion that takes about an hour to give, and you have to watch them for about an hour later to make sure that there's no reaction. So we've got to find places to do this, infusion centers, places that where they can actually sit them there after they've been diagnosed, and you have to diagnose them very quickly. So when you think about the Regeneron product and the Eli Lilly product, what we need is a concept of operations on how to use it most effectively. And I think that's something that's going to be very challenging for many hospitals to do.
All right. Well, Dr. Amesh Adalja, thank you so much for joining us. We appreciate it.
Thank you.